Good afternoon, everybody. I'm David Baiada, the CEO here at Baiada Home Healthcare. Today is Friday, November 13th, and this is your weekly CEO update during the coronavirus pandemic. I'm joined by our infection prevention leader here at Baiada, Susan Engel. She'll be hopping on to help share some perspective on how to make your Thanksgiving holiday as safe as possible. Nora Triola, our Chief Clinical Officer, and my usual partner in crime, is taking a much needed day off today. Really grateful that she's taken some time to refresh. First thing I want to cover before I invite Susan into the conversation is to talk about our employee experience survey, which will hit your email inbox this Monday. This is our opportunity to continue to solicit your input and perspective on what we're doing well, what we're not doing so well, what we should stop, start, or continue. Your feedback's so critically important. We read every single comment, every single answer. We're really working hard to aggregate themes and opportunities for us to respond quickly, make changes, adjust, to create an environment where you continue to feel safe and supported during the coronavirus pandemic, where you have the tools and resources you need to take care of your clients and support their families, and where you feel like we're creating an environment where you can practice your craft and do the work that you are so passionate about to take care of others. So please take the time to complete the survey. Your feedback's critically important. I look forward to not only reading and digesting, but then to taking it and using it to drive and craft improvement. With that, I want to invite Susan to join the conversation. We're going to talk a little bit about how to create a safe Thanksgiving holiday during the coronavirus pandemic. Susan, you out there? Great.
Thank you. So the center or core of everything we've been doing during this pandemic has been around the safety of all of our employees and clients. And the CDC has put out some information to keep all of you safe during our traditional Thanksgiving gatherings, which we know are so much fun with our family and friends. However, they can increase our chance of getting or spreading COVID or even the flu as flu season starts to appear this month. The safest way to celebrate Thanksgiving is to celebrate just with your core household members and to share your celebration virtually where you can with your family and friends who don't live with you. However, if you do venture out, steps that can make your celebration safer go back to all those core principles of universal masking, socially distancing, staying 6 feet from others, good hand hygiene. And the CDC, as I said, put out a couple more recommendations if you do have gatherings. If you move to the next slide, that may be helpful. And so if you are going to attend a gathering, try to bring your own food or drinks or plates and utensils with you. Make sure you're wearing that mask and only take your mask off for eating and drinking. And when you can, maintain that 6 feet social distancing. One of the key recommendations is to try to avoid going in and out of the kitchen where the food's being prepared and handled. So that's a really great tip. And when you can, find single-use options. So they make the single-use salad dressings and condiments in their individual containers, so you're not sharing. And consider some disposable food containers, plates, and utensils. I know they have some Thanksgiving-themed paper plates available, and so you could utilize those and some paper napkins this year to stay safer. If you are hosting, recommend that you have a conversation with your guests ahead of time to set those expectations, that masking is going to keep everyone safer, as is social distancing and good hand hygiene. If you can, open your windows, and even better, host it outside. Find a way to find a space outside where you can gather safely. And limit the number of guests. Some of our states are coming out making statements to limit 10 persons in a house at any given time for a gathering. Make sure you're cleaning and disinfecting, another core principle. And again, have your guests bring their own food and drink. When you are sharing something, the recommendation is to have one person serve that, so that individual would be masked and they would be serving it, and those coming up to receive the food from that person would be masked also, so that will reduce, again, any risk as you have to get closer to the food and closer to others. If you have made plans to travel, please make sure that you're following the CDC regarding travel restrictions before you head off, because I know they're changing those. And get your flu shot. It's not too late. Flu shot, you can continue to receive that vaccination throughout the entire flu season. But one of the things that we know is it takes up to 2 weeks at times to completely have the antibodies that are needed to protect you. So we're still 2 weeks out from Thanksgiving. So get your voucher and get your flu shot to protect yourself. And wear your mask. Try to stay 6 feet from anyone that's not in your household. And again, washing your hands, avoiding touching your T-zone, your eyes, nose, mouth, and also your mask. And bring with you some extra supplies. Bring some extra masks, hand sanitizer, put some disinfectant wipes in a little Ziploc bag so you can wipe down high-touch surfaces. And please be safe. Hang in there. We know that we've seen on the news that there's a vaccine coming. It's not here now. And we do see a light at the end of the tunnel here. We just have to keep safe while we're waiting to get there, and following our core principles of universal masking, social distancing, good hand hygiene, double downing on them, and cleaning and disinfecting those high-touch surfaces. They're going to keep us all safe and healthy. Have a wonderful Thanksgiving.
Thanks, Susan. Great summary. Thanks for the incredibly relevant and practical guidance, as always. I want to close with just an expression of gratitude, particularly targeted at our home health aides and Baiada nurse practitioners and advanced practice nurses. We're celebrating this year's Home Care Aid Week and National Nurse Practitioner Week with an extra special call out for all the incredible work that you all do, but also all the work that all of you are doing every day. This is an incredibly complex time where even more than ever, you're being called to navigate the ambiguity of what's happening inside people's homes to help them stay safe and independent. And I'm so grateful and appreciative, as I know your clients are as well. Have a wonderful weekend, and we will see you next week.